Hi everyone, my name is Katrina Pryor and I'm a postdoctoral research fellow at the Matilda Centre at the University of Sydney. And my presentation today will be about the feasibility and acceptability of an internet-delivered cognitive bias modification program for hazardous drinking and anxiety among young people. So alcohol use and anxiety are two of the most prevalent and debilitating psychiatric conditions experienced worldwide. And when these problems co-occur, there are ongoing interactions between the disorders that exacerbate one another in a vicious cycle, leading to greater severity and impairment. Both anxiety and alcohol use have underlying implicit and somewhat subconscious cognitive biases that contribute to these symptoms. For instance, people with alcohol use problems have an implicit tendency to approach alcohol-related cues in the environment rather than avoid them. And then some people with heightened anxiety have an implicit tendency to interpret ambiguous information in a negative or catastrophic way. But research has shown that we can successfully modify these biases via brain training techniques known as CBM, or cognitive bias modification. And CBM for alcohol approach biases has demonstrated that training can significantly reduce alcohol consumption and also reduce relapse rates by up to 13%. And then CBM for anxiety interpretation biases has produced significant reductions in a range of different anxiety disorders and types, and there are short-term effects of this training. But in terms of what the gaps are, research has predominantly been conducted in European samples. It's focused on adults with disorder level problems, and anxiety and alcohol use have been addressed separately. So given we know that there are interactions between anxiety and alcohol use problems, the aim of my project was to combine these effective programs together for young people and to evaluate the feasibility and acceptability of this combined program. So my study involved two phases. Firstly, of focus testing. The first group I did focus testing with were experts or service providers, and then with young people, and I had 15 people in each group. And both groups reviewed a beta version of this combined program and then provided feedback on its acceptability, and they gave suggestions for improvement. So regarding the results, service providers and young people said the program was pretty acceptable, it was easy to use and appropriate, but they did say it was less engaging and somewhat less enjoyable, which is really why we wanted to get this feedback in the first place. And then service providers had reservations about the program's potential clinical effectiveness as well. So given the program's low face validity, several changes were recommended. Firstly was the inclusion of a treatment rationale at the outset of the training. Then it was suggested that we include a motivational or psychoeducational module before the first training session. And then lastly was to include a muscle metaphor within the treatment rationale to emphasize the importance of completing multiple training sessions. So the next steps are to pilot trial this program when it's combined with treatment as usual. So watch this space. Thank you.